more often than not, by the end of an intervention meeting, it becomes pretty clear that we need to go to a next step. So sometimes I think the other thing that becomes really important is that I've often said we need to have what I call a pre-intervention meeting, talk about what's going on, and a lot of information comes out because more often than not, the family members and friends all know different things. So when you put them all together, one person will say, well, I didn't know that. And then, another person, well, I didn't know that. So a lot of information comes out. And so when you have the pre-intervention meeting, and I've had some where, I've said, listen, this is really not a serious problem. The situation is usually pretty bad. And so more often than not, by the end of an intervention meeting, it becomes pretty clear that we need to go to a next step. Yeah. And then deciding what that next step is, because again, it can be a simple, let's talk about the problem. And if people feel they can do that, that can be the first step to having things change. Now, again, I've seen times where people feel they can just sit down and talk to somebody, and they do, and they find out that the situation is much worse than what they thought. And when I say that, I mean that someone's more resistant to help or more resistant to giving up the behavior or drug or chemical that they're doing. At that point, then the next step, we might have to escalate what that intervention work would do.